So today we're going to be going over children with autism and how autism can affect their oral health and some home care tips and solutions to better affect their oral health. And these tips will not only be for the kid, but also for some parents' tips as well. My target audience is the parent of the autism child. In an office, I would present this to the parent alone or to the parent with the child in the room as well. So first we'll go over a little overview about autism. All this information on this slide is from Wilkins' textbook. Autism can be defined as complex spectrum of developmental disorders marked by limitations in the ability to understand and communicate. Autism children may have limited initiation of social interactions and they reduce response to overtones from others. They can be deficient in nonverbal communication and behaviors. They can be inflexible and have difficulty switching between activities and changing focus or action. So some obstacles that autism children may have is a higher percentage of plaque, gingivitis, and caries. Plaque being 85%, gingivitis being 62%, and caries being 21%. And gingivitis is just a form of periodontal disease. It is ultimately inflammation of the gums, which can be reversed from adequate home care and plaque removal. Autism children may have significantly more signs of bruxism, and bruxism is what you see here in this bottom right picture. It's just flattening of the chewing surfaces of teeth. And then also on this bottom left picture is a picture of gingivitis. You can see that the gums are pretty red and puffy. That's just inflammation of the gums from not adequate plaque removal. Autism children may have lack of social awareness, and they may also have a fear of the unknown and also fear of sensory activities. So in this PowerPoint, we're going to be going over some solutions to fix those obstacles that autism children may have at home. The first solution being plaque removal and effective home care. The second being bruxism preventative, and then the last one, exposure. So the first solution we have is a solution for plaque removal and effective home care. So I feel like it's important to first go over what a cavity is. A cavity forms when there is plaque buildup on your teeth. The bacteria in your mouth make acids, and when plaque clings to the teeth, the acids can eat away at their outermost layer of the tooth called the enamel, and that is according to Kids Health. So it is so important to remove plaque to prevent gingivitis and cavities. So some removal tips that you can display with your child at home. If they have sensory issues, you can start with the baby steps until they get more comfortable. You can start with using your hands to apply pressure on the cheeks and lips. And then once they're comfortable with that, you can advance to using a warm washcloth, and you can even put toothpaste on the washcloth. And then lastly, switch to soft bristle toothbrush with toothpaste. If they have a sensory issue with flavored toothpaste and they don't like the mint or the kid flavored toothpaste, you can buy a non-flavored toothpaste. And then another tip for adequate plaque removal is using a electric toothbrush. You can assist your child with this, or if your child is more advanced in their motor skills, they can probably do it themselves. Maybe you check them still, but an electric toothbrush will just help further remove that plaque with less effort. And then you can also brush in a room where the child is comfortable. If they don't like being in the bathroom, you can do it in their living room, you can do it in their room, kitchen, wherever your child is most comfortable and you're getting off that plaque and stimulating those gums, it works. And then same for when they are in an office. If they don't like being in the hygiene room, you can even see them out in the front office or in the waiting room. So wherever your child is most comfortable is what we want. The second solution that we'll go over is bruxism prevention. Like I said in the previous slide, bruxism is grinding of the teeth, and it can be voluntary or involuntary. Some people do this whenever they're stressed or in their sleep. Some people do it like when they're driving and they don't even notice it. So it is a high possibility that your child might be doing it in their sleep, or if they get stressed from social interactions, or if they're overstimulated, they might start grinding. A form of prevention for grinding and clenching of the teeth is this picture right here is a mouth guard, and your child will just pop that in and it just helps protect their surfaces of the teeth. You can buy this at the grocery store and boil it and put it to your child's mouth, or you can have your dentist's office make one. And then the last solution that we'll go over is exposure. So according to Journal of Dental Hygiene, when educating children with autism, they benefit from repetition of content when learning new skills and information. So, in other words, exposure can decrease the fear and anxiety of the unknown and can help achieve a productive dental appointment. So the more exposure your child gets to what to expect at their dental appointment, and the more exposure they get to who they'll be seeing and the environment they're in, the more productive that appointment will be. So some tips from Children's Dental Health. You can schedule a tour with your dental office. I'm sure you can talk to the hygienist or the receptionist or even the dentist to schedule that, and they'd be more than happy to even do a video tour, or if you want to come down to the office to do a tour, that would work as well. And then the next bullet says make a visual schedule for a trip to the dentist. So this just means to kind of make it fun for your child. You can print out a schedule, maybe like make it a matching game and have Velcro stickers, like maybe at this 8 a.m. drive to the office. And then once they do it, they can put that Velcro sticker of the car or something. And then the next one being talk to the receptionist, say hi. And then you can put smiley face Velcro. Just making it fun for your kid, and you can even do it at home as well. But like the bullet says above, the more exposure, the better. You can also break the process into smaller repeatable steps, then give a reward or prize. So breaking the process into smaller repeatable steps means the first time you go they don't have to get their teeth cleaned or even seen by the hygienist or dentist at that time. The first appointment can simply be driving to the office and letting them see the outside of it. And if that's as comfortable as they get with that time, that's fine. You can go home, give a reward, and then the next time you go, you can drive to the office and then meet the receptionist. And then once they do that, get the reward, you can go back, wait in the waiting room, meet the hygienist, meet the dentist, just repeatable steps over and over until eventually they'll be sitting in the chair, happy to see their new friends, the hygienist and the dentist and the workers there. And hopefully they'll be looking forward and comfortable to getting their teeth looked at and cleaned. One thing to note though, for the rewards and prize, you want to make sure that's not necessarily edible rewards or candy, because that's kind of contraindicating from the slides before about the cavities and gingivitis. So rewards can be toys, a trip to the park, stickers, stamps, a new craft, just anything that your child will look forward to. And then lastly, you can read books together regarding dental hygiene. Like I've said over and over, exposure is key. The more that they're familiar with the office, the better. And then lastly, what to expect from the hygienist. And all this information on this slide is from the Wilkins textbook. You can expect a predictable and consistent appointment experience. You can expect a conversation with the parents or guardian prior to the appointment. So doing a video call, meeting them beforehand, scheduling a time that works best for your family with a hygienist. The hygienist will be more than gladly to work with you and accommodate that schedule to getting your kid comfortable. You can expect the hygienist to avoid any unnecessary sensories. There'll be no extra noises, conversations, or touching. Some children like to be touched and some don't. Once again, whatever makes your child comfortable. You can expect the instruction in the form of tell, show, and do. So for example, if I had your child in my chair and I was about to look in their mouth with a mirror, I would tell them first, I'm just gonna look around with a mirror, and then I would show them maybe with a plastic mirror or let them hold it and then do it. So then I would do it. You can also expect a lot of patience. And then this bullet says give a plastic mirror that can be taken home to use each day. So giving them something that they will see at the dental office to take home, that gives more exposure to them. One, it's in their comfortability of the home, and then two, just seeing that mirror. I mean, it's different than the mirror in your bathroom. It's a little circle mirror. So just seeing it will make them more comfortable with it, and they won't be so surprised when they see the hygienist pick it up. So even with, if I was going to look in their mouth with the instruction of the tell, show, do, I can give them a plastic mirror and have them do it as well. So whatever works. And then, like mentioned previously, use inedible rewards, stickers, pictures, tokens, toys. I feel like most offices have little treasure boxes that have a lot of goodies in it that make the kids happy. And then here's my resources. But in the end, I know, speaking for myself, I'd be more than happy to work with any family to make your child comfortable and make it a good experience for them to have healthy oral health. Thank you.